Yeah, thank you. First of all, I want to thank ESMO for giving me the opportunity of discussing a little bit about the ESMO fellowship. I was an ESMO fellow in '97, so now it's 15 years ago, and I was in Gustavo Roussy, and Jean-Charles at the time was also working, was at the beginning also Jean-Charles, and it was a terrific experience, and I think that that experience really gave me a great contribution for improving my career. So what I just have to show you some data. This is what ESMO asked me to do today. And I want to start showing you a little bit the history of the ESMO fellowship that were established in '89, and in the first 10 years, so from '89 to 2000, we had approximately 40 fellows that were granted. The vast majority of applications, as you can see here, and the vast majority of fellows came from the European area, mainly from Spain, from Greece, and from Italy. During the next 10 years, so from 2001 up to now, we had more fellowships, so 64 fellows were granted. And again, we see that the vast majority of fellows come, again, it's strange, from Italy, Greece, so we have some economical trouble, so probably this is one of the reasons we have more. But also we have France here, so coming in third position. And what was curious for me was also to see that during the first 10 years, we had mainly application from Europe. Now we have also application coming from everywhere. We had also application coming from the US, from Japan, from South America. So it's really something that people now knows, and this is a great opportunity for everybody, not only inside the UE. What is the country in which the fellowship was done? Well, the majority of fellows went to United Kingdom, followed by Germany, Spain, France, and Italy. Honestly, I expected that Italy was in a lower position, and is just right to France. So this is, for me as an Italian, of course, is a good sign. I also analyzed what are the institutes in which the fellow decide to spend their time, and here I indicate the top 5 institutes. And you can see here that we have, in effect, the top European institute. So the fellows went to the best institute we have in Europe, including the Royal Marsden in London, the Institut Gustave Roussy in Paris, the Vall d'Hebron Hospital in Barcelona, the Karolinska Institute in Stockholm, and the Jules Bordet Institute in Brussels. I also was interested in seeing what was the topic of the project. And as you can see here, almost all diseases were covered. So we had a project in almost all cancer. And of course, when we analyze more in deep the details, it is clear that the vast majority of fellows decide to have a project in what we call today the major killers. So in breast cancer, in lung cancer, prostate cancer, and colorectal cancer. But virtually all diseases were covered. Also, I was very curious to know what was the performance of the fellows. Of course, I don't have any parameter for establish what is the performance of a fellow. So I decided to look at the publication the fellows produced from the beginning of the fellowship up to now. And when we consider the period between 2001 and 2012, we have a terrific number of publications. 1,400 publications were produced by the fellows. And here also I indicated the top 10. We have here the name of people that now are very well known in the field of oncology. So this is another evidence that participating in the ESMO fellowship program represent a very, very, very important opportunity that a young oncologist could have for improving the career. the vast majority of fellows did a very good job and also had a very good perspective. So here now I want to present you what are the opportunity that we have with ESMO for a young oncologist. We have two main kind of fellowship. We have the research fellowships and the educational fellowships. The research fellowships are the translational research and clinical research fellowships, and the educational fellowships are the translational research unit visit, the clinical unit visit, and the palliative care fellowship. And now I show you some details of this project. The ESMO Translational Research Fellowship is a 2-year training with a very strong laboratory component. And this is all the fellowships, of course, are for young guys. And the concept of young here is very, very, I guess, elastic, because all people less than 40 are considered young. Probably we should discuss about this cutoff. But anyway, the cutoff is 40 years, so it's very large. And also the grant here, you can find here what is the amount of the grant for each year, that I think this is the less important point of a fellowship. Then we have the ESMO Clinical Research Fellowship, and this is particularly dedicated to the young oncologists who want to work in a clinical cancer research project. Again, we have, this is up to, for a 1-year fellowship, and again, we have the same age limitation. Then we have the translational research unit visit, that is a very intensive and interactive visit in one of the most important institutions we have in Europe for only 3-4 days. But this is a very intensive training. What is important is the young oncologist during this visit can acquire some informations that are important for implement technology in the institute where they stay, and also can give also very practical information in how to interpret data, for example, when doing a research. We have 4 to 8 fellows per visit, and we have approximately 2 or 3 visits every year. Then we have the clinical unit visit, that is an opportunity to just to observe an oncology care in one of the top European centers. We have up to 6 clinical unit visit fellowship each year. And finally, we have the ESMO Palliative Care Fellowship, and we have the Research Fellowship that is 1 to 3 months, and the Observation Fellowship that is for a minimum of 1 month. This is a very important opportunity we have, particularly because we know what is how much is important in oncology, palliative care, and certainly with this opportunity, the fellow could improve the experience in the field of the palliative care. Of course, all these programs are possible because we have a sponsor, and we have pharma companies sponsoring all these trials. I can say that the most important pharma companies are providing the economical support for giving the money for that is, of course, necessary for doing this kind of activity. So since 2008, when we look at the different projects, we had 27 translational research fellowship, 8 clinical research fellowship, 29 clinical research unit visit, 96, because it is short duration, translational research unit visit, and 16 palliative care. And just I want to give you some practical information on the deadline that we have for each of this program. May the 1st is generally the deadline for the translational research and the clinical research fellowships. We have 2 deadlines for the clinical research unit visit that are March the 1st and September the 1st. And also for translational research unit visit, we have 2 deadlines, February the 1st and September the 1st. And for palliative care, the deadline is the 1st of June. So these are my conclusions. So certainly we have the experience we had with fellowship in the ESMO clearly indicates that this is an important, a very important opportunity that we have, that ESMO is giving to young oncologists. And this is extremely important because by applying, by participating in the ESMO fellowship, certainly there is the possibility of improving our skills, our ability in cancer research and treatment. Of course, this is an extremely important opportunity for improving, for enhancing the career. And of course, last but not least, certainly doing a good research means that also we are able to improve patient care. Thank you.